Hello dear patients, today we are going to talk about the clinical case of PCR analysis for HPV. A patient came without any complaints. He had relations only with a constant partner and he wanted to be checked. We took a complete set where a smear test was included, PCR smear, where we included 21 types of human papillomavirus or HPV. The only analysis that was positive was a positive 6th type of human papillomavirus in this man. Its concentration was 10 to 6th power, which is quite a high concentration. If you do analysis of 21 types of human papillomavirus, then each type is determined along with its concentration. Unfortunately, you cannot give urine or sperm for such analysis. Often patients call and they ask whether you can give urine or sperm for PCR analysis. Unfortunately, it's not possible because for such examination cells are required, cells of genitourinary tract. In some cases we take it from anus or from mouth. You can watch a separate video about condylomas in mouth, condylomas in anus. In such cases the analysis is taken not only from urethra. So in this patient a 6th type of papillomavirus was found, which made us observe genitals of this patient more carefully, using a dermatoscope, and we found small condylomas that you can see on the picture. They are almost invisible for the naked eye. Neither the patient nor his wife nor me did not see such small condylomas during analysis, and there were several of them. So what does this mean? Condylomas were removed and immunogram was done with corresponding treatment, and diagnostics and treatment was done for wife. What does this case tell us about? It tells us that you have to do analysis not only for HPV, but for other sexually transmitted infections for prevention. Many sexually transmitted infections can have an asymptomatic cause, and absence of clear symptoms in the form of pus, itch, reddening doesn't mean the absence of sexually transmitted infections. This patient, without knowing about the presence of viruses in himself, would infect other patients, and he did that. I'll remind you that human papillomavirus can transfer even through a condom, so this doesn't restrict such virus, it only lowers the possibility of infection. So, prevention analysis for any STDs, including HPV, are necessary for every person, and they have to be done at least once in 2-3 years at least, even if you have only one sexual partner. If it is necessary to diagnose and treat different sexually transmitted infections, you can consult the neurologists, urologists and gynecologists of our paid medical center of Dermatov Neurologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.